You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people with gum disease. According to my first guest, he says no more bleeding gums, bad breath, loose teeth, and you don't have to have the invasive surgical procedure. We're talking about laser dentistry today. With us, we have St. Louis's periodontist, Dr. Schlaikjer. Dr. Schlaikjer, welcome to the program.
Thank you, Randy. Thank you for having me today. I appreciate it.
Now, for people that don't know your practice, and I have lots of questions about your laser, who's the typical patient you see as a periodontist?
You know, there really isn't necessarily a typical patient. We actually have quite a wide range of patients. I see patients sometimes ranging in pre-orthodontic, like adolescents, sometimes a little bit younger. We'll look at some soft tissue health for those patients before they begin their braces treatment with their orthodontist. So we see some children in like the pre-orthodontic area, age range, and what we're looking at there are a lot of kids, before they go into braces, the orthodontists will discover that there may be some muscle pulls on their lips that are affecting their teeth. The gum tissue. Some children will actually have receding gums at a very young age. So what we're addressing for those people is we're ensuring that they have healthy tissue before they start orthodontics with a simple gingival grafting procedure. A lot of our patients in the middle age range, we're looking at implant therapy for some patients who have not been able to retain their teeth or need to have teeth taken out for some reason. So we do comprehensive implant treatment for those patients, implant surgery. And then also about half of my practice is evaluating patients with active periodontal disease. So our older population of patients, we're seeing a lot of patients in two categories. One, they either have teeth that have been lost previously, and they're looking to find ways to replace those teeth with dental implants. So my office will treat them comprehensively for the surgical portion. So for some of those patients, what we do is we're able to give them their individual teeth back that they've lost. There's another set of patients who have been missing teeth for a very long time. They have no teeth. Maybe they've been wearing dentures, and most of them are very uncomfortable with those dentures. And that's one of the first things you hear from those people is they don't like the way their dentures fit. And the nice thing is, if we could see more of those people, we can solve a lot of problems for them. We can find ways to utilize dental implants in a very strategic way to fix an arch of teeth to dental implants. We give them their smile back. We give them the ability to eat the foods they want to eat. Most denture wearers without dental implants, they're eating soft foods. They're eating mashed potatoes. They're eating pureed things because they don't have that biting force that we're able to give back to them when we're able to secure teeth to dental implants.
Now, we should mention, so as a periodontist, I guess the general dentist in your area in St. Louis, they send you all of these type of patients. Because you're the specialist, right?
Exactly, yeah. So for the most part, a very traditional way of working is with the general dentist. Once maybe there's something that is out of their comfort zone for treatment, or they recognize there's some problems that I'm able to help them with, they'll refer the patient to me. I'll do a separate consultation so we can evaluate exactly what that patient's problem is. We can give them the ideas and the solutions, like we're talking about, whether it's replacing teeth with dental implants, whether it's, we're going to talk shortly about the laser periodontal therapy. We can talk to the patients about those things, and then we're able to get them back in the office. We're able to make them feel comfortable with their smile and solve problems for them, whether it's a loose-fitting denture or a missing tooth or an active infection. We can address those things, and we can stabilize those patients' mouth, and we can make them comfortable and happy. They feel good about smiling in photographs again. They feel good about talking to people again. It's fantastic.
And then they go to their general dentist, so you bounce them back to their general dentist for the cleanings and or
It's a very
collaborative
collaborative effort. So I have a role for those patients, but their dentist is their dentist, and they need to see their dentist. So we actually get that question a lot. You know, patients will come in and we'll provide some treatment for them, and we'll get them to this, you know, the place they're looking for, this happy place for them again with their smile. And they say, do I need to go back to my general dentist? And I'm like, absolutely. You absolutely have to go back. I'm filling a role. I have some, you know, specialized treatments that I can provide for that person, but they need their general dentist. And I have some patients who don't have a general dentist. I help them find one. You have to have that. It's like not having your primary care physician. You're not only going to go to your cardiologist. You have a primary care physician, and that's really what we're looking at here. So it's a group team effort.
So let's begin then with the laser. And how you're taking care of gum disease. What defines gum disease?
So
and what are the symptoms?
Kind of the symptoms. Let's talk about the symptoms first. So the symptoms for most people, what they're experiencing is they're having bad breath. That's the first sign of way too much bacteria in the mouth. The bacteria is what's causing your breath
So it's
to
like
do
a
that.
bacterial infection, you say?
Absolutely, yes. So periodontal disease, at its core, is a bacterial infection in the mouth.
Okay.
People will maybe have bleeding in the gum tissue, like when you're brushing your teeth or when you're flossing and you kind of rinse your mouth out, you may see a little bit of blood in the sink. That is not a good thing.
A little bit of blood's okay when you floss. Really?
Absolutely not. No, and I get that a lot. People will say, "Well, my teeth don't brush, or they don't bleed when I brush my teeth, but maybe these couple areas bleed when I floss my teeth." And you can just kind of hear talking to that person.
So that's the infection.
That is the infection.
Really?
The infection's causing that tissue to bleed. The bacteria break down the lining in your gums.
Okay.
And that's what allows the blood to come out.
And when you
It's not supposed
zap
to
it with
bleed.
the laser, the bleeding goes away.
Yes, absolutely. So
Okay.
there's a few other steps with that. But
right.
bottom line, yeah, the laser is getting rid of those bacteria. So this laser addresses, or it affects things of color. So the bacteria has pigment. That laser hits the pigment in the bacteria and it kills the bacteria. So the laser will disinfect the tissue and it penetrates into the tissue. And that's the nice thing. Other options for periodontal treatment, there's no way to get that bacteria that's living inside the tissue. And they're clever bacteria. They know how to hide from things. So this laser can penetrate the tissue, the pigmented bacteria that are causing this infection, causing people to lose their supporting bone, their supporting gum tissue, ultimately the number one reason people lose teeth. We can affect that. We can change that. We can kill the bacteria, and we can start them on a road and a journey to have a healthy mouth, have a nice smile, and be happy with
So
themselves.
the people with bad gums, like when they say, I have bad gums,
Right.
that's like
You hear
a
that
gum
a lot.
disease.
Yes.
You go around the mouth with a laser, do the gums get healthy immediately?
Yeah,
over time?
you can see a change in 24 hours. So I've done some follow-ups, the next day follow-ups with some patients. And coming from somebody who was trained and who spent a lot of time in practice doing more traditional methods for periodontal treatment, if you see somebody 24 hours after that, the tissue looks like you just saw them yesterday. But the laser treatment, they come back in and the tissue's healthy, it's pink, and they tell you, I ask, how did everything go? How was your recovery? And almost across the board, totally fine. Maybe took an ibuprofen, maybe took a Tylenol. Really, we're eliminating the need for narcotics, which is a goal. We don't want to overprescribe things.
So there's two ways to treat gum disease across the country.
There are, yeah, absolutely.
Right? And so one way is with the laser, and the other way, talk about the other way. So the periodontist you're training is to kind of cut it out in a way.
Exactly. So the whole goal here is we have to get rid of the bacteria. So if you can't use a laser to kill those bacteria, you've got to cut the tissue that's infected out. So here's how it's normally done. In my training, in my practice, before I started using the laser, we have to cut out the infection. We have to remove the infected diseased tissue. So a typical patient in that scenario, they go through a couple phases of treatment. There's a first phase of treatment. It's referred to as sometimes a deep cleaning by patients or scaling and root planing. That, for a lot of people, is a preparatory phase of treatment. So they go in, they do a deep cleaning, and the problem there is you're able to get the bacteria off of the tooth, a limited part of the tooth. You're able to remove that, but you're still not getting the bacteria that's living in the gum tissue, the bacteria that's causing this infection.
Okay.
So you're doing a partial treatment. You're cleaning some of the bacteria that's causing this, but you're not getting rid of all of it. So the problem is it's just going to grow again.
Just keeps coming back.
Keeps coming back. So for those patients, a lot of them, that's still only a preparatory treatment. So it's typically 2 sessions, 2 separate appointments, and we're just getting them ready for the second phase of treatment, which the traditional way involves, it's surgery. We have to make incisions around the teeth, and those incisions are designed to remove that infected tissue. So the way it's normally done to get rid of the gum disease, and something I do not like to do.
But you used to do it this way.
I did used to do it this way. I did. I was trained. In my training, this is how we were trained, and this is how I spent the early part of my practice, was doing it this way. We have to cut the gums. We have to...
Like to get what? Access to the tooth?
Well, yes. Well, for one, to get access to the tooth. so we can get the bacteria off of the tooth. But the other thing is, without the laser, because we're not using a laser in this method, we have to cut out we had to get rid of the bacteria still. So
if it's infected the gums, you got to cut a little bit of the gums?
You have to cut, sometimes not a little bit of the gums, sometimes a lot of the gums. So we have to cut out the gum tissue. And then we're able to access everything. And to tell you the truth, we sometimes have to go in and even remove some of that bone around the tooth.
Because it gets infected
Because it's infected too. It's diseased. It's dying away. So we have to remove that too. So after we've cleaned out all of that infection, the diseased tissue, the gum tissue, the diseased bone, and we've cleaned the tooth surfaces, we have to sew everything back up. We have to suture everything back together.
Do you use stitches to do this?
We do, yes. Yes, stitches, exactly. That's the only way we're going to get that tissue to start healing. And, kind of bringing up the point earlier you asked about what do people look like after the laser treatment, and they look very good even as soon as 24 hours. When people come back from that traditional cut and sew procedure, they come back in a week, it's healing, but they're uncomfortable, and you don't even have to ask them if they're uncomfortable, but they are, and I do ask.
So the gums are really sore?
They're really sore.
Okay.
They're really sore. It takes a few weeks, sometimes up to a full month, to really heal from that treatment, from the traditional cutting and suturing. It can take up to a month to even really start healing from that, and that's tough on the patients. The other downside is we've cut tissue away. So we're not really talking about that. We talk about it, but the reality is we're lengthening their teeth. We're exposing their roots. We're intentionally creating spaces between their teeth. And I told people this, we're going to create a space between your tooth. I don't want your gums to fill that back in. If the gums fill that back in, it's because you have new periodontal disease and everything's inflamed again.
Okay.
So we have to give them special tools. And really be cautious and work with them quite heavily on using these different tools. So these
people with severe gum disease, their life is basically going in like about every 3 months.
Exactly.
Like a deep cleaning to get rid of this infection.
Yes, because if we can't get all of the bacteria out of there, the bacteria is on a 90-day life cycle. This is what we know.
Right? Okay.
Yes, so it's on a 90-day life cycle. You clean it out. You never get rid of all of it. We can't get rid of all the bacteria ever on anybody.
Okay.
Same thing for cavities. We can't get rid of the bacteria. We can keep the bacteria levels low so we can promote health for that person. But you clean it out, it just keeps coming back. It keeps growing back. So
the way you do it, with a laser,
we're killing a lot of that bacteria. We're getting rid of it with the laser. That's the nice thing.
So you don't have to cut.
We don't have to cut. We don't have to cut open, pain, or cut away long roots, exposed roots, cold sensitivity, food sensitivity, sugar sensitivity. If you eat something sweet, you hear people come back and, I ask them how things are going and, oh, well, everything's going good, but every time I take a sip of cold water, right up here, it just gets me and I cringe. You can't eat ice cream anymore.
Because you cut away
we cut away the gums
in the old way.
Oh, the old way. You cut away the gums, so they have this root exposed. And that's where the temperature sensitivity, this cold sensitivity, is because of the exposed root. That's where they're getting this. So when you expose their root, you're giving them sensitivity.
So the new way, just go around the
You go around the mouth with the laser. So you make a pass with the laser, and that laser is getting all those pigmented bacteria, the stuff that's causing this infection, so inside the tissue. So it kills all that bacteria. The other thing it does, which is maybe sometimes overlooked or not always explained very thoroughly, is our gums attach to our teeth, okay? And
like they hold them in place, kind of a way.
Yes, exactly, yeah.
Okay.
So that laser allows that gum tissue to kind of relax away from the tooth a little bit. What that's doing is that's giving us the ability to clean the tooth, because remember, this bacteria is not just in the gum tissue. It's also living on the tooth in calculus. They call it tartar on the toothpaste commercial. So the bacteria is living in there. We have to get that off too. So when the gum tissue kind of relaxes away from the tooth, our specialized instruments are able to get a little bit farther down on that tooth. So we have a lot better insurance that we're getting the bacteria out of the gums with a laser, but also off the tooth. And we need those gums to relax a little bit, and the laser lets it do that. Okay. So then we take some specialized instruments, we go through the mouth, we clean the tooth, we clean the tooth surface, and then I take the laser again, and I make a second pass around the mouth. And what we're doing there is we're kind of encouraging that gum tissue to come back to the tooth. So it wants to seal back around the tooth.
So just so I understand this correctly, okay, like barnacles on a boat, right?
Yes.
The tartar is underneath the gum line?
Exactly, yeah.
So you scrape off this tartar, or calculus, as you put it. You go with you disinfect with a laser.
Exactly.
The gums grab onto the tooth again.
Yes.
And your teeth get healthy.
Exactly.
Is that kind of how it works?
It's in bottom line, that's exactly how it works. But that last step, when we bring the tissue back to the tooth with that laser, that's a really important one, because in making a comparison with that old cut and stitch method, the difference is there we can't create a very good seal around the teeth with sutures. We've cut a lot of tissue away, so the bacteria gets back in that wound. It delays healing, and we left all the bacteria there. With this laser, when we bring the tissue back, it forms a seal around that tooth. So your bacteria is not creeping right back in to that area. So we're keeping the bacteria out, which is really what the body needs to heal. All of these things, what we're doing is we're tipping the balances back to the body so the body can heal and the body can correct the problem. So that's what we're doing, and we're able to keep that bacteria out of there with the laser.
Let me ask you about insurance. So insurance covers the other procedure, at least a portion of the cutting procedure. Does it cover the laser?
It does. It does.
So
actually,
about the same amount?
It's the same, and the way we work that, and without getting into details, there's codes. Okay, and we use the same code. So the insurance doesn't know which one we're doing. And they don't need to, because it's on the up and up, but they don't know what we're doing. They just know you're getting a periodontal treatment, and that's all it is. So it doesn't matter if it's the laser that you're being treated with, or if it's the old cut and suture.
So when you talk to your other, because logically this makes sense, right?
Yeah.
If it's a bacterial infection, treat it like a bacterial infection,
Right.
kill the bacterial infection, the gums get healthy.
Yeah.
Or try to cut out a bacterial infection, which if it's microscopic, you really can't get to it, right? By cleaning it out.
No, and that's the issue. You can't, and that's why we cut away. We can't get it out without the laser. We can't kill it all without the laser.
So you don't do the surgical way anymore to get rid of gum disease?
Very rarely.
Okay.
There are some indications, and that's really where the clinical expertise comes in, to understanding what's going to work for that patient. There are some indications where you do have to do the traditional method, but it's very rare. I can think of one person this year where that was the indication, and that's how we treated her. But laser is absolutely the way to go.
Now there's 20, I'll put you on the spot here, there's 20 million, well I Googled it, so there's about 20 million people here in the US that have an upper lower denture.
Yeah.
Now they lost their teeth most of the time, according to you, with gum disease.
Number one reason
if
people
you
lose
could have
teeth.
got these people early, are you under the impression that you could have saved all their teeth?
I would love to say 100%.
Well, do you think that?
Well, I'll be honest with you, it'd have to be 90% of them. We would at least be setting them up to keep their teeth. And you're right about that. There's a lot of denture patients. The patient population is aging in this country.
But if you got that bacterial infection early on,
we
they wouldn't lose their
we
teeth.
could have taken care of their problem. I mean, the earlier we see people to treat them, the more effective treatment is, the more predictable treatment is, and the outcomes are always going to be improved.
Okay, good.
It's a disease that keeps getting worse with time, and when you catch it early, just like anything, you catch it early, it's less expensive, it's less invasive, and it's way more predictable. And that's how we help these people. How we could have helped those people.
We talked in the green room. You have a challenge as a periodontist because the local general dentist send you patients. But by the time you get them, they're at end stage. They're in trouble. Right? They're losing teeth.
And unfortunately, too many cases, you're exactly right.
But could they see you like at the first sign of bleeding gums?
Absolutely, yes.
Like they don't need a referral to see a specialist?
No, they do not need a referral to see me. But I do want to make that point we talked about earlier, needing that general dentist. I'm going to work with their dentist, and if they don't have a dentist, I'm going to work with them on finding somebody who I think would be a good fit for them. But the earlier that we're able to see them and diagnose specifically what's wrong with them, their problems. And I think that's one of the things that we kind of miss, is that diagnosis part. As a periodontist, I did my dental education. I got my dental degree like every other dentist, but I did 3 additional years of a residency training. It was very focused on this niche area of gums. Dental implants, so replacing teeth that have to be lost or are lost, and gum treatment. So the understanding and the ability to diagnose, make prognosis for teeth, and understand the different treatment options, that's what I can provide that patient. When they sit down, I can go through them with a lot of other options. I'm not limited or restricted by certain things. I know exactly what we need to do.
So these people that need dental implants, because you do dental implants.
Yes, absolutely.
To some of them you think, boy, if I could have saw them 4 or 5 years ago, they wouldn't have lost their teeth.
Again, way too many times. the earlier we find those people and the quicker we can address that infection, the more likely we are to save their teeth. And dental implants are great, Randy. I have a dental implant. I do. I cracked a tooth. Nothing I can do about it. So dental implants are great. I do a lot of dental implants, but people are happier with their own teeth. And if we can keep
so
your teeth,
save the teeth.
Way better. And we could definitely have fixed a lot of those implants. A lot of those implant patients that I have, that the other periodontists have, that all the people are putting dental implants in, a lot of those people would not be implant patients.
Because that's expensive to lose a tooth.
It is. If we'd have gotten to them in time and we had been able to take care of that infection early enough.
Okay, good. Now, we have a slide. I guess you could swab a person's mouth.
Yes. Yeah, you can.
And we're going to look at this slide. And we're showing the bacteria, like a typical mouth with gum disease.
Yeah.
Let's take a look at the slide. So what is that we're looking at?
So what you're seeing here is a lot of the bacteria swimming around your mouth. This is in your gum pocket. Wow. This is around your tooth. This is in your gum tissue. And imagine trying to get that stuff out of there with a scalpel and a pack of sutures. You got to cut it all out. You have to cut all that tissue out. Whereas with the laser, we're able to touch the gum tissue where all that stuff's swimming around, all these things.
So the laser hits those bugs.
It hits those because they're the pigmented ones. They have color to them.
Okay.
It hits those bugs. They absorb the energy. They die. They go away. And that's how we're able to get rid of them.
Now we have a second slide. So this is what? After the treatment?
After, exactly. So
they're kind of dead.
They're dead. They're not moving around anymore. They're not squirming around. They're not rolling around. They're not wiggling around. They're dead. So the infection right here, we've eliminated those living bacteria that are causing you to lose bone.
Okay, so we have another slide that shows how you're using the laser around the mouth and comparing it to the old traditional way. Let's take a look at that.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periodontist laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
So that's the way it is?
Yeah, absolutely.
I mean, it looks kind of simple. Could I do it?
Well, no, you can't do it. So to a degree, yeah, you're right. It is that simple when you look at it. But I mean, there is a lot of technical demand on that. And that's why, there's mandatory training even to get your laser. You have to go to education for that. And as a periodontist, the foundation for those things that we're looking at there, that was built in a 3-year residency.
Okay.
And so when it comes down to it, yeah, it can't be that easy. But no, Randy, I don't think you should start doing that.
Now you say it's life-changing for people, the procedure.
Well, yeah.
How so?
Well, I mean, it is. I see a lot of patients. So they come in, and at a consultation, I always ask people, what do you want to change about your smile? And I hear these answers like, I want a wider smile, I want a straighter smile. Oh, there's some veneers I've been looking at getting. But they're not really that convinced of those things. And then once we go through the periodontal evaluation, once we get their mouth healthy and they come back and the gums are healthy and the teeth look good, those kind of like vague, well, I want to have whiter teeth, I want veneers, become the priority. We get phone calls from people, patients. When can I whiten my teeth? When can I go get my veneers? People come in.
Like their goals change.
They're absolutely, because before we were able to get their mouth healthy, this idea of whitening teeth and straightening teeth was like, well, I would like to do that, but there wasn't a hope for that. There was no hope for that because they have an infection told, by their dentist. They told them you have an infection, so why would you hope to have white teeth and straight teeth if your teeth are infected? But once we solve that for them, those hopes become important to them, and now they understand that they can have those things, so they're motivated. They're like, I got to get this done. Like, when can I start? And sometimes I have to pump the brakes on them a little bit. Well, you can, but give me a little bit longer. Give me another month. Let's see how things are going. But that becomes important for them. I did have, a lady come into the office recently, and we were going through the consultation process where I sit down, I meet somebody in a room with a table. It's not a dental chair. So we sit down and we talk, and you're talking to somebody, and I'm sure you've noticed this before too, but I was kind of picking up on this, and she's talking and kind of doing one of these things. Like when she smiles, the hand goes up, or you're kind of holding your lips together, or you even start looking down. People start looking down at you because they don't want you to see their teeth, and we're talking to her. And, it kind of comes out that doesn't want to take photographs. She doesn't want to take pictures with her family, with her friends. She doesn't like talking to people. She doesn't want to smile and laugh in public. There's always something going up protecting her. She's not happy. She doesn't feel comfortable. She doesn't feel good about herself. So what we do with her, we go around the mouth with the laser. We kill the bacteria. We get the infection under control. We get her healthy.
So the gums start looking good again.
Amazing. Right off the bat, amazing. And now she's
so
she's ready to
teeth
start
become
growing.
strong. How?
They do. The bone's not infected anymore. The teeth, the natural structures of the mouth, the gums, the bone, they're able to tighten and hold those teeth back together.
Okay, interesting.
That's exactly what's happening. It's important. So now that woman is moving on into the phase of orthodontics, and then she's going to go get teeth whitening and start getting some veneers. And before I saw her, she's talking like this and keeping her lips down. By the time she's done with the veneers and the orthodontics, she's going to have $1 million smile. She's going to want to talk. She's going to want to talk to people, not trying to hide anything. She's going to be happy, engaging people just on a day-to-day basis, ordering a cup of coffee.
Now, what if knowing you were coming today, talk to somebody, they go, well, both my parents had dentures. My teeth are bad. Genetically, I have bad gums. You could still even help those people.
Yeah, I hear that all the time.
They do? Okay.
All the time. And that's important.
What do you say to that?
I explained to them it's an infection, and there's a family history of these things, but you can be the one to break that cycle. We can get you to not be mom and dad and grandma and grandpa in dentures when you're 30. We can get you there, and that's where we talk about those treatments and the ways we get them out.
So this has changed your profession as a periodontist?
Completely.
From surgical removal of the bacterial infection
to minimally invasive treatments,
to killing the bacterial infection
with laser.
A laser.
Yeah, absolutely.
Is that how people find you? Because I know you're like 99% of dentists refer you people.
Exactly, yeah.
But they Google like laser dentist or holistic dentist.
They can, yeah, and then there's a lot more and more, especially with the laser. There's a lot more patients referring patients because they see how these things are helping them and how not as scary as they thought it was.
Look, we are out of time. Final message. Somebody watching this. They have puffy red gums, bleeding gums, bad breath, loose teeth. Maybe they were told their teeth have to go.
I hear that a lot too.
Maybe they're scheduled for one of these other surgeries from a qualified guy. What do you say to them?
I say get a second opinion. Let me have a look. Come in for a consultation. We can review things. We can see if there's other treatment options. The laser may work for that person, and we may be able to avoid some of those other things, and we can get them healthy. We can give them their smile back.
Okay, good. I want to thank you for coming on the show. Great stuff.
Yeah, thank you very much, Randy. I appreciate it.
Thanks. You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.